What will you do if the monitor shows you 200 under 120 millimeters of mercury and the patient is complains of a severe headache and blue-red vision? Let's begin. Over the next 10 minutes, we will take a deep and focused review of hypertension and hypertensive crisis, what is essential for the NCLEX, including key definitions, quick assessments, nursing priorities, important medications, treatment goals, common exam mistakes, and practical tips to choose the right answer with confidence. Let's talk about definitions. What is hypertension? Hypertension is a chronic condition that increases cardiovascular risk. In the acute setting, not every high blood pressure reading is an emergency. Let's talk about hypertensive crisis. This one is divided into two categories. The first is a hypertensive emergency. This one is with severe blood pressure elevation, usually higher than 180 under 120 millimeters per mercury, with evidence of acute target organ damage. For example, the brain, heart, kidney, aorta, retina, or lungs. And the second one is the hypertensive urgency. Usually, it's the very high blood pressure, but without acute organ damage. The critical step in NCLEX question is to recognize if there is an organ damage. That determines both priority and management. IV and gradual control emergencies versus oral and slower control emergencies. Common NCLEX focuses: priority design, nursing actions, safe delegation, drug safety with comorbidities, and patient education. Let's see some warning signs and symptoms of emergency. Watch for any of these red flags. Neurological changes like confusion, decreases level of consciousness, focal deficits, or severe headache. Chest pain, suggesting ischemia or aortic dissection. This with severe pain and possible new murmur. Shortness of breath. From acute pulmonary edema, we are talking about shortness of breath. Oliguria or raising creatinine, and retinal bleeding or sodium vision loss. If any appear, think hypertensive emergency and notify the medical team immediately. Which are the initial nursing priorities? First, safety and ABCs. Secure airway, ensure oxygenation, and place the cardiac monitoring. Second, measure blood pressure accurately. Use the correct cuff size, keep the arm in the heart level, and confirm with a second reading. Third, rapid target organ assessment. Neurological status like Glasgow scale, pupils, strength, and in the cardiac, you have to see the EKG or pain. In renal, the urine output creatinine, and the pulmonary, you have to see if there are some crackles. Fourth, establish continuous monitoring. For example, like the telemetry, and insert a large bore IV line. Fifth, communicate and collaborate. Notify the provider and prepare IV antipersin medication if emergency is suspected. An NCLEX tip is the priority action is the one that prevents immediate damage, monitoring, notifying, and following orders. Now let's see the goals in hypertensive emergency. First one, do not lower blood pressure to normal immediately. The goal is to control reduction to avoid cerebral or organ hypoperfusion. There's a clinical rule. Reduce mean arterial pressure, MAP, by about 10 to 20% in the first hour, unless otherwise indicate, for example, aortic dissection or high ischemic stroke with specific goals. Let me tell you the main IV medications in hypertension. Nicardipine infusion. It's an IV calcium channel blocker, easily titrated. It's a good first line for many emergencies. Labetalol, bolus or infusion can be applied. It's an alpha and beta blocker, excellent for acute ischemic stroke or general emergencies. Avoid in severe asthma or AV block. Clofidipine is similar to nicardipine, is a rapid and easy to treat. The almost difficult is that it's not always available. Sodium nitroprusside, very potent vasodilator, requires close monitoring and caution due to possible cyanide toxicity with prolonged use. Nitroglycerin IV, it's indicated for pulmonary edema or coronary ischemia. An NCLEX tip, known many side effects, for example, like hypotension, reflex tachycardia, and possible renal impact. Recognize contraindications, for example, beta blockers in bronchospasm. Let's move forward for some scenario-based management. Aortic dissection. It's a rapid heart rate and blood pressure control needed. For example, you have to use labetalol plus nitroprusside or nicardipine, and in the worst cases, prepare for surgery. High ischemic stroke. Follow strict blood pressure goals if thrombolysis is planned. Otherwise, avoid sharp blood pressure drops. And finally, pulmonary edema. Use nitroglycerin and diuretics, and please close monitoring. Some ongoing nursing monitoring. Bedside monitoring. You have to make a frequent blood pressure checks during IV therapy, a continuous EKG, and oxygen saturation. Early urine output in labs specifying the electrolytes and the creatinine. Access for hypoperfusion, for example, signs of confusion, vision changes. And finally, evaluate drug response and titrate according to orders. Don't forget the patient education and prevention. Teach adherence to chronic hypertensive therapy, low sodium diet, and physical activity and weight control. Explain warning signs, severe headache, blurred vision, chest pain, or shortness of breath, and when to seek emergency care. An necklace education tip is to choose answer, then focus on the preventing immediate harm. What to do if blood pressure rises suddenly and when to call for help. Let's review common necklace mistakes. Confusing urgency versus emergency. Don't give aggressive IV drugs if no organ damage is. Trying to normalize blood pressure quickly. Usually this is wrong. Prioritizing teaching before safety and monitoring. Forgetting medications contraindications, for example, beta blockers in bronchospasms. Here's a quick checklist: monitor mnemotechnique. M, from measure blood pressure correctly. O, from oxygen and observe vital signs. N, from notify provided immediately. I, for IV access and initiate order infusion. T, for target organ assessment, for example, neuro, cardiac, renal, and retina. O, for order labs and monitor results. And finally, R, for record and re-access frequently. Now I will give you 3 ankle tips for choosing the right answer. The first one, is there organ damage? If yes, acute IV intervention. If no, oral medicine follow-up. Second one, prioritize safety, ABC monitoring, before education or delegation. And third, avoid sudden blood pressure drops unless specifically indicated, for example, in aortic dissection. The key for the ankles is to differentiate emergency versus urgency, prioritize safety and monitoring. Know your IV medications: nicardipine, labetalol, clofazimine, nitroprusside, nitroglycerin, and never ever lower blood pressure to normal instantly. These decisions save tissue and save lives. Before you go, save this content and share it with your classmates in college so more nurses can join our learning community. Follow us in our social platforms for more focused NCLUS reviews and quick study guides. Together, let's keep growing and preparing for the success.